you get the data that gives you some insight. You think that's the right thing, but it's like everything. It's like you got to get the right recipe. The first time, I was in a conference last weekend, there's someone was like, yeah, we're always making cookies. And I was like, what are you talking about? Are you talking about the cookies are going away? No, we're all making cookies. Yeah. And the first time we make the recipe, we burn the cookies. And so it's not about just, always having that perfect cookie.
Right.
Is, you're learning every day with what you do.
Hello, healthcare. Today, I'm excited to be joined by Otto Angulo from Mount Sinai. Otto has been leading the efforts at Mount Sinai on patient engagement, brand reach, and in general, connecting with healthcare consumers. Otto is the Senior Director of Digital Marketing at Mount Sinai, and leading these charges is not an easy process. Healthcare consumers today are much more savvy and much more technical than ever before. They're accustomed to content and messaging that's personalized for them across channels, across mediums, and across their lifestyle. So I'd like to welcome Otto to Hello Healthcare today. Otto?
Hi, Alan. Thank you for having me here, and happy to have a conversation with you and take you through some of our experiences and things that we've been doing at Mount Sinai that help, with those issues or concerns or that are happening. It's just an extremely changing environment right now. And it's not just about healthcare in a sense, it's about how consumers want to receive care. It's and the competition that we're getting. It used to be your corner hospital, now there's a WebMD or there's a CityMD or a MedRite or some urgent care in the corner. And there's even so many products online like Teladoc, Amazon buying One Medical, that we have to put ourselves out there in a way that it's seamless and that it also creates education and awareness. That we felt that is our differentiator from some of those competition.
Right. So interesting, you mentioned a lot about retail health and a lot of these digital health companies. So definitely a lot of competition. So how do you keep Mount Sinai's patients engaged amongst all this competition?
So like I was saying, I think, one of the things that we figured out is that, this retail, healthcare, they're focused on the immediate care. So like, you have a cough, how can I get it, solved? Or I have a fever, or I had COVID, what do I do? And some of those things, come, as part of the entire healthcare journey. Yeah. But when you go to one of those things, you cannot really, it's like, if you have heart palpitations, do you need, a heart surgery? Do you need heart stents? Do you need anything that is more than that? Mm-hmm. And so what we do is we differentiate by saying, giving that message and giving that awareness and education, becoming more of a resource that then takes you to that action. And so, I'm having hip pain. Mm-hmm. Well, if I go across the street to, this urgent care, can they really treat me?
All right.
And COVID, generated this because people, were scared. They needed something immediate. But at the same time, they know that if they need something that is specialized or something that is that, they have to go to a hospital, to a health system that is doing it. And that's something that we are really putting out there. We're doing it in all of our campaigns. We focus our campaigns on, kind of the entire funnel. Like there's an awareness, there's the middle of the funnel where, people are investigating, and then obviously the conversion side of it. And so it's just those ways of getting them into your doors. And then when they're in your doors, how do you keep making sure that they're loyal? There's always this kind of thing about like, you're not Nike, you're not, Disney, you're not a brand that, you can be loyal. Like, it's a healthcare system. And in the area that we are in New York City, there's a competition across the street. You walk out and there's, a competitor, New York Presbyterian, NYU, Northwell. And so what you have to do is you got to kind of give that information in the right times, in the right process. So how do you do that? And we do that, with different campaigns. Mm-hmm. We use our CRM as a tool, as for insights. We use that for targeting, and then executing campaigns and also driving that, kind of entire journey and touch points until we can get them to become a patient. After they become a patient, then they come into this other cycle where we're touching them, and we do this engagement. We keep our brand present. We have some communications that are coming out, not just like appointment reminders or things like that, but we have a newsletter that has become some kind of an avenue for patients to understand their post-surgery journeys or their continuous life cycle with healthcare, which is a different path than, you go buy sneakers and, and you buy them and that's it.
Right. That's really interesting, especially when you're talking about, using CRM for insights and targeting and being kind of the head and the lead for digital marketing. What strategies and channels have you found to be most effective for engaging folks?
So it all depends on what type of journey they are. So we do campaigns for our brand, and so for our awareness. And for those, there's certain channels like programmatic that are really great. Social is a pretty good awareness. When we need, when we're focused on the conversion side, there's more like the display side or the SEM side are really critical. And then some touch points as well as like, health risk assessments. So we're putting those ads there, we're putting those, and we take them to these specialized landing pages where people can kind of identify what area of their journey are. Like, I'm having this pain. Why am I having this pain? If I have this pain, like there's like a series of questions that can then take you. It's like, okay, maybe, you need to have an appointment with the doctor. Here's a way to schedule this appointment. Yeah. Or if if you are like in this middle of the road, you want to keep informed, give us your email and we'll keep you informed on this.
Right.
And we start capturing all these kind of moments from the patients that are allowing us to either target them in, if they really need something, to act immediately, or if not, we can kind of keep nurturing that lead, little by little. And so, so it's something that we have felt that is key for our success, because we're getting really good leads. Yeah. And when those leads come in, we're being able to attribute those exactly to the campaigns or to, things. And it's something that we started kind of having more access over the past about year and change, because it was kind of like a black box. It was like, okay, we have all these leads. Yeah. Where did they go? Right. Now we have a way to get them, from the beginning all the way to the end and see how much are they generating revenue. Are they not generating revenue? Are they coming from the right places? And so our team has become savvy or smarter doing this. We are now have information of like, what are the right zip codes to target at the right times? What are the media or the areas that these people are looking at? Our website, we've seen with some of these things, our website traffic is also increasing because we're building content that is relevant to what the campaign is. It's relevant to what we're seeing and we're listening to in all these mediums that we're putting out there.
Yeah, that's a very holistic approach for sure. And you make the workflows right now sound so simple, but I know it's super complex.
It definitely is complex. Obviously, I'm trying to kind of put it in context for everybody that, is listening to this, because, if you kind of think about this, it's not just, it's like, okay, we got the data and let's do this and this and this, and then it's done. Right. It's a constant journey. Like it's, you get the data that gives you some insight. You think that's the right thing, but it's like everything. It's like you got to get the right recipe. Right. The first time, I was in a conference last weekend. There's someone was like, "Yeah, we're always making cookies." And I was like, "What are you talking about? Are you talking about the cookies are going away?" No, we're all making cookies. Yeah. And the first time we make the recipe, we burn the cookies. And so it's not about just always having that perfect cookie. Right. Is you're learning every day with what you do. And so the first time you don't have the perfect cookie, but you start knowing it's like, oh, I put too much sugar, I put too much, no. And like now you have, something that, it's edible and like it's giving you, great results.
I love that analogy, which kind of leads me to kind of the next question. So as you're learning to bake these cookies, we'll continue to use that analogy. I mean, what have been some of the things that you've learned? What has been some of the biggest challenges for Mount Sinai in terms of implementing this?
Well, one of the things it's obviously resources, and so you have to be really, really smart in how to use those. And so we've kind of partnered with two agencies, and so we see great results with an agency, and then we say like, well, we're doing this, and then why can you not do this?
Right.
And you start kind of digging into some of the things that they're doing, and then he's like, why are we doing this? And why is Facebook telling me this? And then if I go there, it's not telling me the same thing. So it's kind of like, depending on where you go, there's going to be, there's not a perfect truth. Agency A can have, kind of like the recipe a little better. And the other one is doing it and it's getting results, but it's not kind of like matching. And it's never going to be a perfect science between the two agencies. And so what we've done is we've taken best things from both sides and try to apply them into the campaigns. And the reason we're doing that is because we know that this agency is better for this type of procedure or this type of things, and they have that expertise, and the other ones have this other expertise. And so, what it's kind of comes to mind is that there's a knowledge curve, and at the same time that there's that knowledge curve, not everybody is specialized in the same thing, and so you have to have sort of avenues to kind of venture. And so there's companies that could be great for orthopedics, and then there's the ones for heart, and some that will never touch what you want to do, and they'll some will tell you, and some they'll like, yeah, give us the money and we'll do it, and then you're suddenly like, we've been doing this for a month. Like, why are we not getting it? It's like, well, and so you start digging. And so in one of those kind of digging, we saw this like, yeah, well, you're saying that we're getting leads, but the leads are not for this right program that we're trying to do.
Yeah.
Like, are you not like, I don't like, saying like, here's 40 leads. It's like, do you know what those 40 leads are? Like, there's a system that is telling you what those. It's like, no, we have not thought about it, but like, that's a great idea.
Yeah.
And it's like, I'm paying you to be the one that comes with the ideas instead of me having to. So it's also been a learning curve and building a right team. And so it hasn't been easy in healthcare because, there's been a lot of competition. There's a lot of people thinking that healthcare is a very complicated thing to do, and goes against their principles. Yeah. We've had some candidates that said like, yeah, like I cannot market someone to go to this hospital, this other hospital, because, it's a personal choice. Right. It's not about a personal choice, and we're not doing that. We're doing something that we're creating awareness to say like, hey, we're doing this great thing that you might not know. Like we did the first trach nut transplant. Do you know that? Like somebody doesn't know. Like, it could be in the news, but you paid attention to the news? Probably not, because you're tired of hearing the same news all the time. Right. So they have to find those ways to show that as well.
Okay. So based on what you're sharing with me, a lot of the Facebook ads, a lot of the digital advertising that you guys do, let's dissect that a little bit. I want to take a deeper look into the strategy, or if there's a difference in strategy between new patient acquisition and actually activating your existing patient base. How is that different in your world?
So I think there's a bit of an overlap in both, because you could come to the hospital because you had like a hip surgery first, but then you could have something with your heart, or you can have something with something else, or like, another family member has cancer. So like the journey never stops. You could have probably be a patient this year and then not come for 3 years because you are controlled. And so you could, in the life cycle of a patient, usually someone that has kind of lapsed for 2 years becomes a new patient again.
Right.
And so it's a cycle that is kind of like, sometimes people, depending on what type of illness they have or condition, you're in that journey constantly. Right. So like those, like people that have like chronic diseases like diabetes or heart disease or something like, like they're coming, someone that has things like orthopedic or some other kind of illness like that, it's not coming constantly. I get, unless you break your foot like every 6 months or you break something. I was one of those patients that broke. I was in that was like there as an orthopedic patient constantly. But going back to your question is, how do we differentiate those? I think there's two kind of journeys. There's the one that is, you're already here. How do we keep you kind of in that cycle?
Mm-hmm.
And with those, we have kind of like sort of a lighter touch.
Mm-hmm.
And so we have like I was saying, some newsletters and some kind of touch points that are less aggressive and saying like, hey, Alan, you need to come for a new, and also we need to follow rules, HIPAA rules. And so It's like, you kind of keep that thing. And so, for example, with those is like, like we know certain topics like health and wellness and certain things that are kind of keeping those people engaged.
Mm-hmm.
So like diet things, or like a new weight loss center, a new test for radiology. People feel scared to ask those questions.
Yeah.
So sometimes having those avenues are easier to kind of navigate and say like, well, I feel scared of telling that I got to get an ear exam, or like I do. If you see it in an email, it's like, oh, I'm going to do it. I might not need to tell my wife, or I might not need it because I did it. And then you come back, it's like, oh, here is it. It's not like, like you have cancer, you have to have the conversation. So if you have something, like it's brand new and you're like, like the cancer journey.
Uh-huh.
And so in a cancer journey, there's different levels of cancers and different types of cancer. But if you kind of think of the overall journey as, it's sort of a come to Jesus kind of journey. And it's like people either feel that something is not working or not feeling well. You go to a doctor, the doctor gives you some diagnosis, and that diagnosis then makes you go into this circle of like, okay, I'm going to research at WebMD. I'm going to go to the web. And so it's partnering with some things like WebMDs and saying like, okay, now we have these ads that can say, Mount Sinai has cancer services that are tied to this cancer article that then you can click on there. Or you have our website where we have all this health library where we're telling them, all this information that then ties to like the doctors and things like that. We have, some programmatic ads and some Facebook ads that then kind of target to go to those specific landing pages that can then take you to take the action to either request an appointment or to kind of go through that HRA or health risk assessment where it's like, do you feel the pain here or there? Maybe you should go do this.
Right.
And so we do that. You get the diagnosis, you get the treatment, and we're adding new services into the mix. And so like we have now an infusion from home. So all these patients now don't have to come to the hospital. There's like, there was the COVID kind of fear that's like, okay, you got to go to the hospital, get your infusions, kind of get COVID. I have cancer. I'm going to get. So we're building all these other layers that can kind of, now you're in the funnel, you're in the system. How can we keep you there and keep you happier and knowing that these things are happening?
Right. That makes a ton of sense. And I'm assuming, like you said earlier, all of these metrics and insights are then captured in your CRM to drive additional communications downstream. Is that correct?
Yes. And so we have like some like intelligence that is kind of capturing all this, and then it helps us build personas. And so we can identify, and in some instances, a little bit of personalization, because now we know that you're coming to these pages, but then if you come back to Mount Sinai, we can kind of give you a little bit more of a personal journey rather than a very kind of broad one if you're a brand new person coming into the sign.
Okay. Yeah, that makes sense. I think a lot of the examples that you shared also, once a patient is on the care journey, it seems like you guys have it figured out in terms of how to nurture that patient through their care journey. Talk to me a little bit about perhaps more proactive type of communications, folks that haven't been diagnosed, but they're existing patients, right? So maybe Alan, I'm 20, I'm healthy, I'm single, I don't really have anything major with me, but perhaps I'm at high risk for diabetes or some other chronic condition.
Yeah, so that's something that we're starting to kind of get our feet wet more and more, and that came with some of the intelligence that we have with the CRM, because now we can kind of add layers of health, propensities of health that are kind of going to take us to identify patients that could potentially be in risk for X or Y.
Yeah.
And so that is something that it's new. It's something that is that is in our journey of like evolving our touch points and evolving our way of saying. So we're starting to do a few campaigns in the next few months where we are using that intelligence and that data that now we can say like, hey, this is someone that has this propensity, that has this, and how do we get them into this journey without telling him that like, hey, you got diabetes or you got propensity to to have a knee surgery or something like that. But you get into this journey that we can kind of get you in there, and so that's part of kind of our evolution from going into this kind of big kind of campaigns where we're targeting like a big universe,
right?
Into kind of looking into our internal patients. And so we're starting with some smaller campaigns, and there's a lot of other things that come up, as a healthcare system, and it's integrating with other departments to understand, those kind of things that are there that they don't really communicate to their patients. So it's like there's all these things that come from like we have a department that is population health, and what that department does is they have a universe of patients that one part is underserved, but then there's others where where we get like a bulk of patients that are highly commercially insured or Medicare patients that at some point have had some relationship with us, but have never come back,
right.
or they have been diagnosed with something and they went across the street to NYU or NYP. So this intelligence is giving us the opportunity to kind of bring back some of those people, understand where can we serve them better, and how do we get them to kind of become loyal. And it's a big word in healthcare because you're loyal sometimes to your doctor, and people follow doctors. Right. And if your doctor goes from one hospital to another, I've seen that, and people go that. There's people that think that loyalty is because you have an app like MyChart that, right. I have all my doctors in one, and then the doctor leaves like, how do I do? Like they get right. freaked out. And so it's kind of getting that education there.
Okay. Yeah, that's definitely something that's very unique and interesting about healthcare. Other industries, you typically have a brand loyalty or a brand following that healthcare consumers kind of gravitate towards. But I think when it comes to healthcare, that's kind of a key challenge. What are some of the metrics that you guys are using today to kind of measure and capture that, whether it's attribution, whether it's conversions, to kind of understand and optimize your outreach and your campaigns?
So like I was saying a bit ago, we've been getting better with data. Yeah. And one of the things that the agencies were, it's like, we give you leads. We give you all these leads, and so, so they kind of shot themselves in the foot because they gave all these leads to like this doctor that, does this special surgery. It's like, we gave you 50 leads,
right,
in like a month. And the doctor's like asking all these questions and all these things. And it's like, well, I only see 2. Like, where are the other 48?
Right.
And they're like, well, they're there. And so we go back to the CRM. It's like, well, there's 48, but 48 were not for this doctor. There were 2 for this doctor, and then there were 48 that were for something else.
Right.
There were for OBGYN,
right.
ENTs. And so what it did is kind of like, okay, we're spending we're spending all this money. You got us 50 leads. We didn't lose money because we got the leads. The doctor that gave the money, or like that was doing the surgeries, it's a complex, expensive surgery. So that paid off for the thing. But so we did money and we get a little extra from the other things. But when you are telling someone that you give them 50 leads, you got to be very sure of what that is. And so with that, we became much, much better and telling them like, okay, if you tell someone that you did this, you got to tell them exactly what those are.
Right.
And so how are we going to do it? And so we had to come up, with a strategy for the agency and say like, hey, well, you're capturing all this information. Why are you not matching this with the real doctor, or matching it with the procedure, or matching it? And so we had to help them build this matching system to be able to attribute, saying like, okay, now we have this, so, we call it the halo and the relevant attribution. Right. So every halo event is great. Yeah. It's extra, but if you're trying to, do a thing for vascular surgery and you're getting ENT, that doctor is not going to care about the ENT. He cares about the vascular, and that's what he is really focused on. Right. And so when it's building that trust and communication where when you attribute something, you attribute it to the right place. Right. And that's where like the CRM and this tracking tools are becoming our allies.
Right. Yeah, definitely. That makes a ton of sense, especially from a healthcare marketing side. Now let's flip to the other side. When you're talking about KPIs and metrics to your leadership and your executive team, what are the key metrics that you guys use to present to leadership, or quite honestly to your finance partner, in terms of, look, my campaigns, my technology that I've invested in are effective?
Yeah. So in the past, it was like kind of like in the past, which is like just about a year ago. It was kind of like a guessing work. And we say like, okay, we got, this 40, 50, 100, 200 leads. You got all this, from, not only just leads, but calls and everything. So we were able to get to the point where we had actual, leads, qualified leads, but we were not able to get to the next layer. So we knew that, and we would create an estimate that, 10% of the people would become into a real appointment and 5 would become a surgery, and this is how we are going to attribute. Now we can go from the actual person lead all the way to the end of the journey, where we can say, okay, we got the 50 leads. Now out of that 50, 40%, schedule an appointment, and then out of that 40%, then 10% really became in the appointments, and this is the contribution margin that we got at the end. So we were able to go all the way down to our kind of return on investment. Right. And so it was something, it's something that in healthcare has always been a little bit of a very hard sell to do, because marketing was never the priority. Marketing, in past history, I got someone from finance saying like, well, you're just marketing. Why do you need finance data? It's like, you're giving money. Why? How can I tell you that I need money next year for my budget? Right. And so it's something that they've realized, and that's why we partner with our finance team, our strategy team, to be able to get all the way to the bottom, allowing us to get this data, and we can kind of say, now, we know what the real cost of a person having this type of procedure is going to be, and how much contribution margin we get. So we know that if we put the money in the right places, we are going to get that money back. Yeah. And we're going to be able to, share that success. So the way that we present it is, now we have like this kind of templated slides where we kind of take you through the stories. Like, this is the campaign. This is, how much traffic it drove. This is then from that traffic that they drove, these were the leads. This from the leads, and the calls. This is how much, revenue it generated, and this were the campaigns it affected.
Right.
And now this is the total money that we get
Right.
to you. And so, so finance is very. It's when I say very, it's very excited that we can get there.
Yeah.
And they have really appreciated that we've done that. And that we've looked to get there.
Mm-hmm.
And that we can show, it created more effort on our side to always kind of try to push ourselves. And so now we know what are the campaigns, what are the, the areas that are successful for us. And we can kind of work with strategy and say like, hey, have you heard that this and this is, is getting us a really kind of return on investment? What do you think?
Mm-hmm.
Should we put our investments there? Do you see it growing? Do we have enough doctors to push this? So now it's not just about, kind of like we're doing the priorities, like, orthopedics, heart, cancer. Yeah. Now we can kind of go into areas where we were less, not less successful, but less active. And now we're successful. And so we have the means and we can target very niche. We can kind of say like, this is the consumer, or this is the patient, and this is the area where it is. And like, that's where we can put our money. We can go very granular and say like, this is the zip codes. This is, we don't have to target a big DMA or something like that.
Right. No, thank you for sharing that story. I think it's incredibly valuable. One of the key things that here at Hello Healthcare, we're trying to also help spread the word and educate on is how can healthcare marketers be viewed as a revenue generator versus a cost center? And I think you guys are one of the few leading health systems that I've had the opportunity to speak with who have kind of started figuring it out. So if you were talking to one of your peers at a system that hasn't figured it out yet, what type of advice would you give them in terms of, geez, you figured this all out. I don't even know where to start. Where do I even start?
So, it's funny because I had a conversation a few months ago with someone at another health system where I used to work, and there's like, you started all this process and you left, like now you let us hang. And so like, how do we how do we kind of get this back, on track, and how do we get it? And so, one of the things that, kind of exists is, and there's this fear in healthcare that, like we're going to get hacked, and it's the fear that comes, from the top down. Mm-hmm. And so, like the CISO and the, and all the security teams are always kind of like, marketing is like always getting hacked. They're like using Facebook, they're using that. So it's, one of the things that I said is like, you need to kind of go to those people and say like, hey, the way that we're doing this is not to get hacked. Right. There's processes, there's, all the people that are going to get access to this are going to get vetted. They're going to, there's going to be all this. So start there. The second part of it is really come prepared to that meeting of what you're going to need. Because it's like, I just need finance data. And, like there's tons of finance data.
Right.
And so if you come prepared and say like, okay, in order for me to become successful with the information that I need, these are the few things that I need. Don't come asking for everything. If you throw the kitchen sink, you're going to get nothing. Here is come really focus and say like, in order for me to calculate attribution and contribution margin, I need this, this, and this. And maybe these other two things are maybe possibilities. Can we get those?
Yeah.
And so that opens the conversation because you're not telling finance like, give me your entire financial system and I'm going to absorb it into the CRM and I'm going to use it. And it's like, what are you going to do with that? Are you going to, what are the, so come prepared with that. And then lastly is always be upfront. Never let anything kind of fall through the cracks. If the process is slowing down or if you need finance to know, and always keep your kind of leadership, in sync with you, what you're doing and why you're doing it. Because if you kind of don't tell them, and then all of a sudden, they're asking like, why, Otto, I gave you all this, you have all my trust, and where is it?
Right.
And it's like, well, it's in finance, and, work in tandem with that. And so it's make sure that you're, good with security. Don't go to finance asking for everything, and then keep your leadership, aligned and, in the loop with everything that you're doing.
That makes sense. That makes sense. So given where you are now, what's kind of next? What's on deck?
We spoke a little bit about, our consumers, and our patients. So one of the things that we're trying to do is there's a lot of data sources. We're trying to become efficient with our data. So we're doing a big push to standardize data, in the way that, people just come and say like, hey, I got all these people, come on, add it to your system. And, so it's like, it's not all about adding, and like they might already exist there. Like, how do we set up processes to be able to do that? Because that data is going to be, at some point interesting and important.
Yeah.
And then how do you use it? It's just not data that sits in, in storage or something like that. So that's one of the big things that we're doing. We're gonna start using more of our models into kind of those personalized, kind of unique journeys and campaigns, and continue to evolve in kind of reporting. That's going, it's a never ending story, but it's also a way to kind of continue be able for us to tell the story and success. Because, as you said, marketing has always been kind of like seen as you always use money. You need more money,
right?
But we are contributing. We create a big contribution to the health system year over year.
Right. Wonderful. Look, Otto, I've really enjoyed this conversation. And one of the key things that our audience would like to know is, obviously, we want to continue this conversation. What's the best way for folks to get a hold of you to either pick your brain or to learn a little bit more insights in terms of digital marketing?
Yeah, well, I think, like LinkedIn is, always a great tool, but, I think that's the starting point. But if you any need my email, you can always add that, into, the notes of the podcast or anything like that. Yeah, happy to answer that.
Okay, fantastic. Well, thank you again for coming on Hello Healthcare. Really enjoyed our conversation. And to our audience, thank you so much for listening today. And until next time, hello.
If you want more of the latest from healthcare's thought leaders, subscribe using the button below. Or you can visit hellohealthcare.com to get updates directly in your email.